Hello and welcome to the webinar for the 2019 Employee Benefits for Dimension Development Company. During about the next 15 minutes, we're going to be moving through all the different coverages that are offered through Dimension Development, some of which are listed here: medical, voluntary plans, dental, vision, life insurance, disability insurance, a health spending account, pet insurance, and then COBRA. A couple of things to note before we move through. Our annual open enrollment period this year in 2018 is going to start October 15th and will end on October 26th. Everybody must go online to Benefits Connect. Information on that will be towards the end of this booklet that I'll highlight before we leave you. And just remember, what you pick sticks for a year unless you have one of these qualifying events that the little hand is over now. Marriage, birth of a child or adoption, things like that will allow you to change what you pick right now, but in general, what you pick sticks for a year. Most of the medical insurance this year remained exactly the same, with one exception. We have a new plan offering, which is this middle plan. The insurance carrier is still Aetna. The plan year starts January 1st and ends next December, and all deductibles roll till the end of this year, but then reset January 1st. So we've got three different plans at three different price points, and all of the price points will be on Benefits Connect when you go in and enroll in your actual coverage. The differences that I want to highlight are this. Let's start down here at the bottom. Out-of-pocket maximum. So as you can see, in a worst case scenario, each of these three numbers is for covered expenses in the next 12 months. The first plan is $6,450. The next plan is $5,800, and the third plan is $5,800. So it really depends on how much you utilize the benefits underneath that number. Secondly, each one of these has different deductible amounts. The first plan has a $5,000 deductible. That means before insurance starts to pay, you must satisfy the first $5,000. After the first $5,000, then you only have up till $6,450 or $1,450 left until you've reached your out-of-pocket maximum. That difference between the deductible that I just mentioned and the out-of-pocket maximum is filled with copays on prescriptions. But you don't have copays on prescriptions on this plan before you meet the deductible, only after. That's the biggest difference between this plan and the other two plans. The other two plans have copays, which is just a discounted price tag when you access care. You have different copay amounts for primary care and specialist. You also have copays for virtual visits, 24/7, 365 access to a doctor over your phone. You have copays on these two plans when you have a retail or a walk-in clinic, and the deductibles are lower as compared to the plan on the far left-hand side. The other two big differences between these two plans is you have copays for prescription drugs before you meet the deductible. You have some out-of-network benefits as well, but remember, always stay within the Aetna network, which is the Open Access Managed Choice POS. Couple of things to note about the health savings account. It's only available on this plan on the left-hand side. It's called a high deductible health plan. And you have these amounts depending on how many people you enroll in coverage that you can set aside pre-tax into a bank account. Up to $3,500 for an individual or up to $7,000 for a family. But you must meet up to $120 a year in order to be able to do that. A couple of tips on where to go. As a general rule, steer clear of the emergency room unless it is life or limb threatening. Urgent care facilities can do the trick for a lot of things, and this is a helpful slide that you'll also be able to pull up elsewhere to be able to remind you that many things can be taken care of at the primary care doctor's, retail walk-in clinic, or urgent care center. In fact, I had a friend of mine who was pregnant at the time, which you always need to take seriously if there's a medical condition that's ongoing. She mistook where she went, and she went into a freestanding emergency room, which is an emergency room outside of a hospital. and she just needed saline because she was a bit dehydrated. She walked out with a $5,000 bill, and she thought she was walking into an urgent care center, but she was walking into a freestanding emergency room. So be careful of that. This teledoc slide is the one that I referenced earlier. For $40, you can call a doctor 24/7, 365. I like this for any kiddos that are on the plan. I used this most recently when my third kid had pink eye. I called the doctor. It took me about 15, 20 minutes, and they sent a prescription in to the nearest pharmacy. Another medical option this year is the same that we've offered in the past. It is called a minimum essential coverage plan. So this is different than your major medical, and they serve different purposes. The major medical covers an unlimited amount per policy year. This minimum essential coverage covers a limited amount per policy year. So depending on what you have, for example, if you go to a doctor visit, they will pay up to $75 per day. Your wellness exam, $75 a day. If you go into the hospital, it's $300 a day to a max of 90 days per calendar year. So they have a set or defined benefit amount that they pay for different items. This is another example of a limited benefit. This is an AFLAC policy. So most people are pretty familiar with that name. So the minimum essential coverage policy and the major medical policies pay money to doctors and hospitals. However, we all know that when events happen, you have out-of-pocket expenses. AFLAC is different in that they send these amounts directly to your mailbox. If you have a hospital stay, then they're going to give you $1,000. And then depending on what happens, there are different benefit amounts. I actually have an accident policy like this for myself. My kids are in sports, and if one of them, God forbid, breaks their arm or leg, then AFLAC will send me a check depending on the severity of the injury. The critical illness policy covers all of these things in here up to different benefit maximums. So if these items are a concern, then you can choose on Benefits Connect how much you'd like to cover. This hospital policy is for when someone goes into the hospital. The only carrier change that's different this year is that we have a new dental carrier called Guardian. Their website is guardiananytime.com. The network is Dental Guard Network. The ID cards are electronic only. You have a low plan that covers a little less and a high plan that covers a little more. Both plans have 0% and deductible waive for preventative services. That means when you go in to get your teeth cleaned twice a year, that's $0 to you. The biggest difference in these two plans is when you go into the dentist, there's more coverage on the high plan if there's something outside of that routine teeth cleaning. You have a little bit of orthodontia covered here, and you also have this rollover feature that is available on the high plan. Here's what that means. It's like cell phone minutes of the past. If members use less than $600 a year, they can roll over $300 to the next year. So if I just got my teeth cleaned and that was it, I would use less than $600 in a year. I would be eligible to roll $300 over. That would increase my annual max by $300 next year. So instead of $1,250 per covered individual, I would have $1,550 per covered individual. The vision insurance is the same as it was last year, VSP. We've had pretty good experience with this carrier. The biggest benefit is in standard progressives. Those are for folks kind of like me who have whose vision is a little worse. You've got a $150 allowance for contact lenses or $150 allowance for frames. And what confuses people sometimes is this benefit frequency. When it says once every, that means that you can't get both glasses and contacts in the same year. You have to pick one and then cash pay for the other. The next section that we're going to cover is life insurance. Depending on hourly or office, exempt versus non-exempt, you are eligible for different amounts. The plan is 100% paid for by Dimension Development. So now would be the time when you go and enroll in Benefits Connect to make sure your beneficiary information is accurate. Your beneficiary is who catches the football, so to speak, if you're not holding it anymore. So just make sure that you elect someone to be your beneficiary. Voluntary life and accidental death just means this. If you want more life insurance than the free life insurance that's paid for by Dimension Development, then you can apply for that. Benefits Connect will do a good job walking you through. If you want more, you can see how much more you could qualify for. You would apply for it, and it will auto-calculate the amount once you go through the system. Short-term disability insurance is also available. Yes, pregnancy is considered a disability according to this policy. You have to wait 15 days before the benefits begin, and up to 60% of your income, your pre-disability income, is protected up to $600 a week for 26 weeks. So this helps if you know that you're going to be out or you have a concern in that area. When you go through Benefits Connect, you'll be able to toggle through a couple of the buttons and be able to see whether or not this coverage is attractive for you. Aetna also has an employee assistance program. This is for confidential, counseling and referral services. Username and password is here. It's free to you and confidential. Pet insurance is also offered for those dogs and cats. You'll go to a different website right here, petinsurance.com/dimdev, and you'll be able to calculate the cost. Premium only plan simply means taxes are not taken out of your benefits. And the rest of the information is a series of required notices that I'll scroll through because y'all can read that on your own. Question and answers are on this page. So this is a good page to reference, as well as contact information for anything that you may need. All eligible employees do have to go through enrollment annually. Otherwise, your benefits will cease or terminate on December 31st, 2018. Evidence of insurability forms. Those are those forms if you want more life insurance, if you're not a new hire. Employees or spouses have 60 days to complete their forms. So please pay attention to the mail. Sometimes those are easily thrown away. Contact information, as I referenced earlier there, some helpful glossary of terms, and here is a screenshot of Benefits Connect. The online system is enroll.benefitsconnect.net/dimdev. It will walk you through the price tags of everything that we just went through today. We're at the end of our presentation, and on behalf of Dimension Development, thank you for your time and have a great year coming up. Thanks very much.